A lot of changes happen during the second half of life. Join Kash Mahmood, owner of Vargo Hospice and Home Health, and his guest as they explore topics to help you navigate the second half of your life. And now, here's Kash.
Hello, everyone, and welcome to Second Half of Life with me, Kash Mahmood. The topic of discussion today is caring for mom, what you need to know about her Medicare plan. And our special guest today is Brad Brawner with Advocate Health Advisors. He will be sharing some very minute details about Medicare plans. As we know, we're going through the enrollment periods right now. I like to call Medicare a maze, and Brad's the man to help us. So how are you doing today, Brad?
I'm doing great, Cash. Thanks for having me on today. And this is a good topic, and I'm looking forward to sharing a few minutes with y'all. I just want to say before we get started, per CMS guidelines, I don't represent all the carriers in the area. Anything I do say will be about the carriers I do represent. If you want more information, please go to cms.gov or 1-800-Medicare. Got that out of the way.
Excellent. All right. Now we can get to business. So before we dive into the questions, Brad, what I would like to do is, share with our viewers a little bit about yourself. What got you into this? Helping seniors is a blessing, and we all cherish that. But what's your story?
Well, we all have a story. We all have our why, correct? So, I've been in insurance for over 20 years, and whether that be property or casualty or the under 65 market. But for me, the story that really touched me was my father recently passed away. And what I found is that his Medicare was not what he should have had. If he had a different plan, I think he could have gotten the treatment that he needed. Because of that, a little too late for him, but maybe I can help somebody else in dealing with their parents or dealing with themselves and their Medicare Advantage plans or their Medicare supplement plans or their original Medicare plans.
Wow. That's interesting because I got into this, because of my dad and the experiences that he had. So I can completely relate. So Brad, let's start with the very first question. How can an adult child find out what type of Medicare plan their aging parent is using?
Okay, it's a good question. And really, it impacts a couple of assumptions before we answer that. And the first one is assuming that the parent is healthy and the parent is able to give them that information. And we, as the adult children, need to talk to our parents and have this kind of information. Go ahead and ask mom and dad, hey, I need a copy of your Medicare card. What kind of plan are you on? And really, who is your agent? Because that agent is someone I can go talk to if that is a need arises and something happens and I have to have someone to call because mom or dad had a stroke or a heart attack or they're in the hospital and they're not coherent. We have that information. And that's the easy answer. And that's the easy assumption. The tougher answer for that question is if they had that stroke or that heart attack and you don't have this information yet. You don't know who their agent is. You don't know who to call. You don't know what carriers they're represented by. In that case, we got to do a little digging. Hopefully you can find their Medicare card, and that's a big deal because you have their number on there. Then you can go to cms.gov or you can go to 1-800-Medicare and you could ask them, with cms.gov, you can plug the number in and try to log in to find their information. And now if they don't have a local agent, they're talking to someone out in California and it's or talking to someone in Michigan or wherever, they just bought it off a 1-800 number, it's going to be a little bit more difficult. Last resort, call 1-800-Medicare. If you have your parents' name, date of birth, you can call them and just say, look, my mother's in the hospital. I need some help. Here's her name and her date of birth. Here's her address. And I need to find the information of what kind of plan she has right now and what we can do about it.
Mm. So really plan forward because sooner or later you are going to need it. So
if you talk to any financial advisor out there, they're going to tell you to make sure you have a copy of your parents' will. At the same time, you want to make sure they took care of us for all these years. We want to make sure we return that favor back to them. And by doing that, if you have this information, and it's not a fun conversation to have, mom doesn't want to have it, I don't want to have it, but eventually we got to sit across from the kitchen table and go, hey, I need a couple of things for you so I can put them in my safe at home. And that way, if something does happen, we have these decisions made.
I agree. So, Brad, we hear a lot of different terminologies when it comes to Medicare. The
Hmm.
two that we constantly hear are an Advantage plan and a supplement plan.
Hmm.
What's the difference, really?
Uh, they are different. They both kind of work they push different ends for the same means kind of thing. We're looking at there's pros and cons to both. A medical supplement plan works with your original Medicare. Usually there's a premium involved in that, but the good part about a Medicare supplement plan is you go in there with your card, you put it on the desk, you have your services done, and you leave. Medicare supplement, or what's also called Medigap, it's the same, it's the same terminology. Covers that gap between what original Medicare covers and what it doesn't cover. Now, the big thing to know here is original Medicare does not have a stop loss or a max out of pocket, which means that the 20% co-insurance on original Medicare, it just keeps running. So
Hmm.
Medicare supplement are going to cover those gaps in your Medicare coverage. That's the upside of a Medicare supplement. The downside of a Medicare supplement, and I'm going to talk the pros and cons of each. The downside of a Medicare supplement is there is a premium involved. Generally speaking, it's a few $100s, and it goes up as you get older. Um, Also, you're also paying for your Part B, and then with the Medicare supplement, you also need to buy a prescription drug plan to go along with that Medicare supplement, and they all work kind of in conjunction together. So the upside for that is you put the card down, you get your services, and you walk out the door. Medicare Advantage is going to look a little bit different. It works more like your traditional health plans that Cash, you or I are on our group plans now, where they have your co-insurance and your co-pays. There's going to be just a ton of plans on the Medicare Advantage side that you can choose from. Medicare Advantage over Medicare Supplement adds certain benefits like dental and vision and hearing. Gym memberships. A lot of times, your acupuncture, your chiropractor, those kind of things are all added into a Medicare Advantage plan. And the other advantage to that is there's generally speaking, now this does vary, but generally speaking, it's a $0 premium for those plans. Now, the downside to that is if you go to the hospital or you go to the doctor or go get your whatever service you're done, there's going to be the co-insurance and co-pays that go along with it. So when you're looking at a Medicare Advantage versus Medicare Supplement, either you're paying on the front end or you're paying on the back end, depending on what works out best for you. And my advice, if you're looking at an Advantage plan, is always look at the max out of pocket. Let's see where my bleeding stops. Right? Let's see, is it 3,000? Is it 6,000? Is it 9,000? And it's going to depend plan to plan. Now, right now in the market, we're seeing, I believe, about 48% is on a Medicare Advantage plan, about 21% are on some sort of Medicare supplement plans, and the rest, the other 31% or so, are on original Medicare. Um, my advice is if you're on original Medicare, look into something because there's a lot of gaps there.
Right, right. Interesting. Um, so, Brad, Medicare rules are, I'm going to say, changing almost every year, right? So, um, and it's almost impossible to keep up with them. Um, are there any Medicare rules that the child should know about, like the 3-day rule, and then so many other ones we keep hearing about?
How much time do you have, Cash? Medicare is a bureaucracy. There's going to be there are rules on top of rules on top of rules. The one you brought up, the 3-day rule, which essentially says that if you're going to get home health care, you have to be in the hospital for 3 days on an inpatient before you're going to qualify for that. There's all kind of qualification rules for just about everything. Your business in the hospice space, we're going to have to get a doctor to sign off on hospice. The patient or the power of attorney is going to have to sign off on a hospice, and the hospice organization is going to have to sign off on hospice. So there are rules on rules on rules for CMS. It's really impossible to know all of them. I always, and I said this earlier, talking about having a local agent, someone who you can count on, because if one of my clients calls me and asks a rule, there's a good chance I might not know the rule, but I know where to find it. And so I can go out there and say, all right, Mrs. Smith, let me give you a call back. I will find this out for you. Um, you know, Again, I'm going to harken back to have these things planned out for mom or dad before it happens. If you're looking at, for example, home health or a hospice kind of situation, don't throw darts at a dartboard because you don't want to put mom into a place that mom doesn't want to be in for her last 3 months of life. So make sure you go out there and you do the research for mom and dad now, especially if they are in good health. This is when they can help you and they can say, all right, well, if this does happen, and I had an experience with hospice that was fantastic. I know my father passed away, but he had a great experience. They kept me informed. I knew them. I was 2,000 miles away, and I felt like I was right there. So make sure you know this stuff before going into it.
I call it a partnership. It's an extension
Hmm.
because when the most critical time for care comes along, that's when you need the right partner to actually help you take the burden off the care so you can really pay the attention and focus on the love element. But
Yes, yes, because you're not making good decisions then.
right.
I know. My mother was she was off the deep end. So decisions had to be made, and it fell on to me to make these decisions. And I'm glad we knew what we do, but I didn't know enough then. I know more now.
Yeah,
So if I can get to anybody, get there this weekend and talk to your mom or dad.
I agree. So Brad, if a if a parent is on an Advantage plan
Hmm.
and needs home health care or hospice care, are they able to choose the one that they want? I know there's a lot of confusion out there about this stuff when we
Hmm.
talk to potential families or patients and so on.
Well, also whether you're on a supplement, original Medicare, or Medicare Advantage plan, you know, um, the hospice care falls into the original Medicare. That's their jurisdiction. So you have a lot of autonomy on who to do that, who to use, and shop your hospice care, shop your home health. I always think when I'm talking to home health or hospice or any of those, you remember the old movie Happy Gilmore where he put his mother in what looked like a great facility from the outside, and it was a, it was a quilt sweatshop. Um, you make sure your parents know where they want to go. Um, but when it comes to benefits and things like that, if you have a Medicare Advantage plan, always just reach out and call your agent, call your carrier, have those benefits coordinated ahead of time. That way, when mom has to go to the hospice care, or mom has the home health that comes in, and you talked about rules earlier. I know you're in this business, Cash. You know the rules for home health, and besides the 3-day rule, then there's the day how often they do. Do they have a cane? Do they not have a cane? All those kind of things. So call your carrier, call whoever on your Advantage plan, get your agent involved and say, look, we're thinking about moving mom to hospice, or we're trying to get her home health, and let them coordinate some of that care so there's no surprises on the back end.
Exactly, exactly. No, I couldn't agree with you more. I think it's the surprise element that needs to be avoided. When my dad was in the hospital,
Hmm.
we were going through those exercises, and I again I didn't know as much as I know now, but it's the same exercise, right? Because if you can plan and you can prep because you know these things are coming,
Hmm.
then you can focus on the things that matter at that time versus everything else that kind of becomes insubstantial to a certain degree given the emotional state. So I agree.
Right, right. And it's a tough time to make those kind of decisions. And if they're done for you and you had them ahead of time, you can make those decisions because you don't want to. None of this is fun, but
Yeah,
it needs to be done.
exactly, exactly. And I think it's what we're looking at and what we're dealing with. That's the time when the care for our loved ones is needed the most.
Hmm.
So they did their job when we were growing up. They took care of us, but that's the most critical time for them. So
Hmm.
um, so one last question: what else should an adult child know about Medicare to be able to help their parents?
Um, That's a good question. They should do their research as an adult child to know, know what plan your parents on. Like I've got stories upon stories upon stories. Um, you hate to say this, but you called Medicare a maze. Um, you look on TV right now. It's daytime, and you turn the TV on, and every other commercial is a 1-800 number, and
Mhm.
they're routing those calls everywhere else. Maybe they care, maybe they don't, but you, you want your parent to have somebody they can talk to. I was talking to a lady this weekend, and she was completely thrilled with her plan. She loves everything about it. She's 66 years old. She's had it for a year and a half, doesn't want to switch anything. My question was, hey, where is your agent local? And she said, no, she's up in, Kalamazoo or whatever. She called me on the phone. I said, well, what happens if your parent, somebody needs to get a hold of you, or you need to get a hold of someone, or your children need to get a hold of someone, and they can't find that person. You try to call a 1-800 number, and you're never going to get back to that agent. So think locally when this happens, so that you, as the adult child, can make that call to Jesse and say, hey Jesse, my mom's going into hospice. I was talking to Cash over at Varco, and we have to make this. Can you please help me? And is there somebody there to help you? And I'll say it again. It's the same thing on the hospital. I know you guys do a great job, Cash, and make sure you know that you got somebody who's going to care about your relative, because this is their end stage of their life. If they're under 6 months to live, this is it for them, and make sure they're happy with it.
Exactly. I'm going to tell you a quick story.
Sure.
I think you're talking about the toll-free numbers and the TV ads. I'm not going to name any names, but I had a car insurance with a big company, and I went through their website and portal and all of that stuff. But then when the time came where I actually needed the insurance, it was an extremely miserable experience. I was Googling for a number. I couldn't call anybody. For 30 minutes, I was trying to find a number to call, and I was being transferred from one department to another department. So I think the story goes back to the same exact thing. And that was a car insurance problem. I mean, imagine health of somebody, and you're getting ready to take somebody to the hospital, and it's a loved one.
Mm-hmm.
You don't want to take the chance. You don't want to take the risk. You want somebody who is local. You want somebody who is accessible. You want somebody who you can trust.
Mm-hmm. Exactly. And somebody who's going to be there for you and picks up your call, right? And when you call that 1-800 number, I don't know the company you were with. I could probably guess what it rhymes with, though, because I was in property and casualty for a good long time in my life. But somebody you're not going to have to press 4, then press 6, then press 4 again, and then get hung up on. Right now, look, my mom's going to the hospital. I want an answer. I want to know what I can do. Let me get a hold of somebody. And that's where an agent comes in for you.
Yeah, exactly. And I think another story that I will share, we actually had one of the agents from your firm, when we were onboarding a patient for hospice, that agent actually met us at the patient's home with the family. And that's the kind of personal care that you get when you have
Mm-hmm.
the right partner. So,
and I love that story, because I mean that's what you're looking for, is some hand holding right there, right? Because you don't want to, you're already emotionally a wreck.
Exactly.
Right.
Exactly. Well, Brad, how do the viewers get in touch with you?
Great. Yeah, I work with a lot of really good local agents here in the Houston market. So we're licensed all over Texas. We have people over there. You can call me at 832-816-9117. And I probably said that too fast, so I'll do it again. 832-816-9117. Or you can reach me at my website, or my email, brad.brawner@advocatehealthllc.com. Again, brad.brawner@advocatehealthllc.com. I'm happy. Generally speaking, Cash, I work more into the management side of it now. So I have agents that I trust and that are really working hard for our people. And then I will be happy to get you in touch with one of them.
Thank you, Brad. And I've met your team members, some of them. You have a great team working for you. I can vouch for that. Brad, thank you so much. You are, as always, a wealth of information. Thank you for coming on the show.
Wealth of something. Thank you so much for having me, Cash. It was great to see you again, and we'll have to get together real soon.
Excellent. Perfect. Thank you, Brad.
All righty.